Hello everybody and welcome to my presentation on atrial fibrillation. This is just going to be a brief overview of some of the main points of atrial fibrillation and then what you can learn from continuing on reading the rest of my project. So atrial fibrillation is often referred to as AFib, which I will call it from here on out. And in 2016, it was estimated to affect approximately 2.7 million American people, and this number is expected to grow substantially over the next decade. AFib is a serious disease, and it causes a 5-fold increased risk of having a stroke. It also increases the risk of heart failure and other heart-related complications. So what is AFib? AFib is electrical impulses that are sent to the heart muscles in a chaotic and irregular manner. They start in the right atrium at the sinoatrial node. You can see that here. And then they're supposed to be nicely sent out to the rest of the heart and to the ventricles. But these chaotic impulses cause the ventricles to increase and decrease their contractions, and the heartbeat rhythm becomes seriously disrupted. A lot of people will say that it feels like they have butterflies in their chest. So there are quite a few risk factors for developing atrial fibrillation. Age is the most prominent risk factor, with approximately 1% of patients being under the age of 60 and the rest being older than that. Conditions affecting the heart, such as fibrosis, hypertrophy, and large chambers of the left side of the heart, heart failure, and ischemic heart disease also increase the risk of developing AFib. Other conditions such as high blood pressure, obesity, sleep apnea, hyperthyroidism, kidney disease, and alcohol abuse are also known to increase the risk of developing AFib. There's approximately 25 known gene mutations that play a role in the genetics behind AFib, and inflammation and oxidative stress markers have also been found to be elevated in those patients with AFib and are considered to be risk factors. So being diagnosed with AFib, we'll start with the signs and symptoms. Some patients never experience any symptoms, and they don't even know that their heart is beating irregularly when they are diagnosed. The most common symptom described by patients is fatigue, and other patients may experience dizziness, shortness of breath or labored breathing, anxiety, weakness, a rapid or irregular heartbeat, confusion, fainting, and even heart failure. In order to diagnose AFib, a physical exam must be completed, as well as an examination of the patient history, family history, and any symptoms the patient may be experiencing. During the physical examination, an irregular pulse may be noted, and it may be even visible in the movements of the jugular vein. After these things have been noted, a 12-lead electrocardiogram should be completed, at which time irregular RR intervals and no distinct P waves are seen for at least 30 seconds in the ECG. And as you can see here on the left, this is what a regular ECG looks like, and on the right here is the ECG of a patient experiencing AFib. So if you'd like to learn more about atrial fibrillation, I encourage you to read on for further details. I talk about the pathology or mechanism of disease, how stress can relate to AFib, inflammation in AFib, obesity in AFib, and then there's a few extra videos and animations for a visualization of what AFib does and what it looks like. I hope you enjoy. And then here are the references used for this presentation. Thank you.